Hello my viewers, you're welcome to Frank NutriFacts YouTube channel where we discuss only about healthy lifestyles. Okay, so it's been a while I've been on this YouTube channel because of so many distractions. Anyway, positive I will say. By the way, none of you sent me a happy birthday message. I was 39 years old on the 23rd of July. So I'm now a big mama, see all the gray hairs coming out. So that's just by the way. So today I would like us to talk about the type of protective lens you will need. Okay, a lot of people do not really know what they actually need. So it's the role or the duty of the eye doctor that is seeing you to tell you the type of lens you need. Now, some people are short-sighted, some people are long-sighted, some have astigmatism, as the case may be. But some, in addition to that problem that they have, they also have challenges with light. Now, this light could be light from the sun, it could be light from laptop, it could be light from normal bulb from the house, phone, and all of that. Now, this sensitivity to light will help us to know the type of lens to give to the patient. Now, for some people, what we'll give to them is just tinted lens. Now, the people who give tinted lens are people that do not really have money. Let's say, for instance, in patients from rural communities, they come to hospitals, and then of course they can't afford transition lens or blue cut lens, as the case may be. So such patients, what you recommend for them is their actual prescription, and then you tint it. Okay, at least it will give them that kind of shade. Now, tinted lens does not block ultraviolet ray, which is a very dangerous ray that when it comes into the eye over time may also trigger the formation of cataract in the eye. Okay, now we also have another one we call transition lens. Transition lens, we basically give it to patients who complain about photophobia, particularly when they are under the sun. They are not just cool when they are under the sun. Okay, and most times they also complain about the sensitivity to light from oncoming vehicle. They are not comfortable when light from oncoming vehicle flashes in their eyes. They get that. Actually, it's normal with everybody. I've never seen anybody who is driving very cozy in the dark and light flashes into the eye. No matter how, there will be that adaptation. For some people, they can adapt and move, while some they can't even tolerate it. They would literally park and wait for the car that is flashing lights on them to pass by before they can continue with their movement. And then we have another lens which we call blue cut transition lens, and what I'm putting on here is what we call blue cut transition lens. Blue cut transition lens is more like a holistic lens when it comes to taking care of all these lights, all these hazardous light rays that I've mentioned about. Now, we usually give blue cut lens to patients who complain about dryness or inability to sustain with whatever they are doing whenever they are using their phone or particularly their laptop. Okay, now you find that some people will tell you, I am okay staying under the sun, but I cannot even look at my phone for 1 minute. I cannot look at my laptop for 5 minutes. Now that differentiates it. Okay, now the light from the laptop or the computer or the phone that disturbs them is what we call the blue light. Okay, now the light from the sun that disturbs people is what we call ultraviolet ray. Now, transition lens takes care of the ultraviolet ray in as much as it has what we call anti-reflex coating, which helps to reduce glare. Okay, now the blue cut lens helps to filter that blue light, which causes that discomfort to the eye. Okay, now the blue cut can also come in form of transition. So in that case, you call it blue cut transition lens. Now, what I'm putting on here is blue cut transition lens. Now, what it means is that the blue cut transition lens blocks both the blue light as well as the ultraviolet light, as well as glare that come from oncoming vehicle and from the environment. Blue cut has the capacity to block all of this light. Okay, while transition lens, or what we call photochromic lens, only block light from ultraviolet ray, which we usually find from the sun. Well, from the sun, it doesn't really mean that the UV ray is the only bad ray that is in the sun. There are other rays, but UV ray is more. Okay, now when you wear transition lens under the sun, the lens start to change from being transparent to kind of looking like a shade. Now the thickness or the rate of the shade or the tint that comes on when you're under the sun depends on the intensity of light. So for instance, now we're in rainy season, and we discover it's always raining every now and then, and you discover that the most times light sun is not all that harsh, it's not all that scorching. So you find that if you wear transition lens or even a blue cut lens and go out under the lens, you find under the sun, you find out that it may not be that dark compared to when the sun is very scorching. As soon as you step out, you find out that it's already dark. Okay, so what I'm trying to talk about now is to guide you, because most times because you do not really have an idea of what you want, you are left under the mercy of the doctor that is recommended lens for you. So I want to like open your eyes more, so that even when the doctor said I want to do this lens, you can go ahead and say yes, do it in this form, make it to be in this form. Okay, so if you're having some form of discomfort when you are using your laptop, your phone, your computer, or any other screen gadget, then what you should request that your doctor should do for you, in addition of whatever the refractive error is to make blue cut lens. Now, if sun does not disturb you, if the light from sun does not disturb you, then you just do what we call blue cut lens. If you find it very difficult to stay under the sun, as well as find it difficult to sustain while using your phone or your laptop, then what you should request for should be blue cut transition lens. But if you're comfortable using your laptop and your phone and you don't have any issue, but where you have issues is when you are under the sun, then what you should request for should be photochromic lens, or what you call transition lens. Okay, now there is also a difference between photochromic lens and transition lens. Now, pure photochromic lens does not have what we call anti-reflex coating, while transition lens has photochromic property as well as anti-reflex coating on the lens. So what I'm wearing here is blue cut transition lens. And now, as you can see me here, I've been busy because I'm doing some work. I'm busy, trying to do some studies. If I'm not putting on this glass, let's say for instance, I decide to use my eye to read, honestly, the least I can go on is like 30 minutes. Before I know it, I'll be having some kind of headache. I'll be having some form of dizziness. Sometimes it will look as if I am tired, I want to sleep. Meanwhile, when you lie down, you discover that the sleep is not forthcoming. That's because of the light that is entering into your eye is, affecting so many things in the eye. So if you are a student, you're a lecturer, you're a banker, or you're into some other business or engagement that require you using computer, and you discover that the computer is not really you don't feel comfortable using the computer, then request for blue cut lens or blue cut transition lens. Okay, it is more expensive than this other one, photochromic and also normal tinted lens, but I can assure you that is the best you can do. Now the children are on holidays. A lot of them are watching television 2/7. A lot of them are handling our iPads, our phones, trying to watch cartoon and all of that. Please, if you can afford it, provide blue cut transition lens for them, because research has shown us that constant exposure to this blue light may cause what we call age-related macular degeneration. Yes, age-related means with time, when the person would have grown older, not really that old, but the person may be at risk of having this kind of disease. So if you can afford it, just try and get blue cut transition lens for all your kids, particularly now they are using phones, they are watching cartoons, so you protect their eye. And again, if you have family history of glaucoma, this very video is for you. One thing you need to do is to take your children for screening to confirm that they do not have glaucoma, or maybe they have, just confirm their status. If they don't have, praise be to God, but you need to also protect their eyes so that they may not have it, or it might delay the time of manifestation. So all I'm trying to say is that if you're a parent and you have family history of glaucoma and you have kids, please try early to protect these children's eye by providing them with blue cut transition lens. It will go a long way to help them. It will go a very long way to help them. All my kids, as soon as the holiday started, the first thing I did was to do refraction. Of course, two of them have refractive error. One is hyperopic, and then the other one also has hyperopic with some bits of allergy. But I decided to do blue cut transition lens for every one of them, because I know they're always on system trying to do one program or the other. So I have to safeguard the eye by providing this blue cut. You too can do that for yourself. Okay, provide all this lens for your children as well as yourself. So I don't know whether what I've said so far has made so much sense. If it has, please, I would like you to give me some thumbs up, share my video, as well as subscribe to my channel. Until I meet you, bye.